subscribe now and press the bell icon. Never miss an update.
Hello and welcome to Health Live at Seniors Today. It is barely, barely wished you a Happy New Year, and now we are on the fourth fourth Saturday of 2025. And as you would have seen, our focus this year has been to look at a few very basic issues that concern seniors. And today we thought we'll have a discussion on lifestyle changes for a healthy life. I repeat, lifestyle changes for a healthy life. And for that, we have invited Dr. Sandeep Sonawane. He's a consultant at internal medicine at Kokila Ben Dhirubhai Ambani Hospital. Before I invite him and say hello to him, let me introduce him. Dr. Sonawane is, as I mentioned, associated with the Dhirubhai Ambani Hospital, Kokila Ben Dhirubhai Ambani Hospital in Navi, Mumbai. He is a renowned and highly trusted personality in the medical fraternity. Dr. Sonawane has rich experience in internal medicine. He offers some advanced medical treatments for diabetes, type 1, type 2, infectious diseases, diarrhea, fever of unknown origin, HIV infection, AIDS, hypertension, influenza, malaria, anemia, tuberculosis, typhoid fever, and various other diseases. Looking at his accomplishments, one thing is sure that he's one of the most trusted doctors in Mumbai. He has numerous successful treatment cases registered in his name, and patients are very happy with the kind of hospitality displayed at the hospital with the Dr. Sonawane, which is why when we spoke to our friends at Kokila Ben Hospital, they advised that we should invite Dr. Sonawane. So welcome to Health Live at Seniors Today, Dr. Sonawane. Yeah. So as always, what we'll do is we'll request Dr. Sandeep Sonawane to make a short presentation, which he will do for the next 20 to 25 minutes. And after that, we will take questions. Do note that this presentation is being recorded. This entire session is being recorded, so you will be able to watch it. So don't bother about taking notes, etc. While the session is on, while he's speaking. Just pay full attention to that. You can ask all questions after the session, after his talk is over. So please feel free to ask questions. We will address them to him. I will address them to him. As always, we prefer senior citizens from asking these questions. So please, only seniors, and ensure that we stick to the topic that is there today, which is lifestyle modifications, lifestyle changes that for a healthy life. Do note that this session is purely advisory in nature. We prefer that he will not perhaps be able to give you very specific advice. And if there is specific advice that he offers, do note that it's always best to speak to the doctor directly in person for a clinical examination and whatever else. Of course, in this day and time, doctors like Dr. Sandeep Sonawane and most of our other doctors are available for a teleconsult, which is available through the hospital website. Over to you, Dr. Sonawane, for this session, and I'll come back to you immediately as you are done.
So, good evening, everyone. I'm Dr. Sandeep Sonawane. I'm a senior consultant physician at Kokila Ben Dhirubhai Ambani Hospital at Navi, Mumbai. So, friends, today I'm going to speak about lifestyle changes for a healthy life. So, exactly what are lifestyle illnesses? So lifestyle illnesses, you can define them as they are essentially non-communicable diseases, and these are linked to the manner in which a person lives their life. So these are not by some external, germs or organisms which infect your body. So communicable diseases such as malaria, dengue. So these illnesses are different, whereas lifestyle illnesses is how a person lives, what is in his surroundings, and what are his habits. So a lifestyle which a person leads, so this is the determining factor for these illnesses. So what exactly what are these lifestyle illnesses? I will give you some examples, such as heart diseases like myocardial infarction, heart failure, atherosclerosis, stroke, respiratory ailments such as bronchial asthma, COPD, interstitial lung diseases, obesity, and type 2 diabetes. These are a few examples. many of cancers are also related to lifestyle, our lifestyle. So these are certain examples of what are the diseases we are facing because of our lifestyle. So why is this? Uh, why these set of illnesses are on the rise? Is because, if you say, if what we used to live, say 50 or maybe 100 years back, was totally different from what we are living now. We have, since last few decades, we have definitely improved on our economic front, but along with this, we are not, there is less awareness among people about, a healthy lifestyle. We, being economically sound now, we indulge into a lot of smoking, drinking. Some young fellows are also doing drugs. So these are affecting the vital organs of the body. Exposure to pollutants, maybe it is from water, food, or air, at workplace or home, is affecting your health. With economic boom, we are now tempted to drive to our destination. We are now restricting our physical activity. With lot of young people, going for corporate jobs, or people who have attend retirement, they have a tendency to sit at home, or maybe at specific or recreational centers, where the body movement is not there. So physical activity has reduced. Young patients, they are having habits like listening to loud music, and poor sitting has also led to a bad posture and multiple musculoskeletal illnesses. Poor and unhealthy habits, we are now bombarded with processed food, foods which have low nutrient value, and there's lack of fruits and vegetables, whole fruits and vegetables in our diet, and more of processed food which is being consumed nowadays. The stress levels have gone up, maybe at workplace or sometimes even at home. So this has also led to lack or poor sleep, and these all things contribute to various lifestyle diseases which we are facing. And unfortunate to say that these lifestyle illnesses, we are seeing a huge or rapid rise in the incidence of these illnesses. So how to tackle them? So if you want to prevent lifestyle diseases, you have to track and maintain a healthy weight. See that you have, you are active physically and mentally. You do exercise, regular exercises. You focus on nutritious food. Be aware that what is junk and what is a healthy meal. Avoid indulging into smoking, drinking, and drugs. And you should have a regular preventive screening of your health status. So I'll be discussing in detail a little bit of these lifestyles and what modifications one can do to, one can improve one's health. So exercise. So we are all aware, that, we have to exercise. So what exercise? Exercise like even simple walking can, of for 30 to 45 minutes, can make wonders, give to your body. Sitting at one posture, maybe at office or at home, this decreases the muscle power. Also, one is prone to develop blood clots in their limbs, which can have a catastrophic effect on their heart. So reducing weight, doing exercise not only reduces body fat, but also reduces weight, helps in better management of diabetes and hypertension for anyone. So what exercise? What are the limits of exercise? What exercise one should be doing? Even walking for 30 to 45 minutes is a good exercise. If your physical status permits, then brisk walking or aerobic exercise are very nice for your body. So what does this exercise does? It helps in lowering your blood glucose level. It helps in reducing the fat content, helps in reducing the cholesterol, controls your weight, increases the blood circulation of your body, and improves your insulin secretions, helps in better managing your already pre-existing illnesses like diabetes and heart illnesses. So exercise is very important. Resistance exercise, that is going to a gym, that depends upon one's physical status, and you can always consult your doctors and take suggestions from your doctors that what are the exercises which I can do. So within your permits limits, see that whatever your body permits, see that you at least exercise 30 to 45 minutes in a day. Yoga. Now we all are flooded with benefits of yoga. So what does yoga do and what does yoga does not do? One should be aware of it. Main thing what I would say that yoga does not cause weight loss. So it helps in increasing your muscle endurance and strength, improves your immunity, improves joint health. But it is not an exercise. So you are not going to burn a lot of calories by yoga. It will definitely reduce the craving for food. The craving for food, like having junk food or like cold drinks and burgers. So having junk food, it will reduce the craving, but it will not burn the fat which is already present in the body. Yoga also helps in reducing stress levels. It improves your blood sugar, reduces your cholesterol, and improves your blood circulation. Various asanas are available for yoga. You need to consult a certified yoga consultant so that he will guide you what asanas are beneficial for you and what are not. What asanas are permitted, or your body can handle those asanas. Only those asanas. I'll give you an example that breathing exercises which are seen in yoga. These are not recommended for bronchial asthma and COPD patients. Okay, so some asanas will not be permitted for pre-existing illness. So please discuss it with your yoga instructor. Discuss, tell them about your illnesses, and then he will suggest what asanas are beneficial for you. Smoking is one of the deadliest habits of mankind, and not only increases the risk for lung cancers, bladder cancer, prostate cancer, but also leads to increased incidence of brain strokes, heart attacks. Many people are losing their limbs. Combination of smoking and diabetes, it's very disastrous for a diabetic patients. Many patients tend to lose their limbs because of repeated amputations, poor wound healing, and the most common contributory factor is smoking. So reduce smoking, and I would say stop smoking completely. And you can always consult your doctor who will help you in giving medicines. Now wonderful medicines are available. He can always give you medicines which will help you in getting rid of this habit if you have one. Another factor which I want to discuss is sleep. Sleep is a very important factor. It is not only rests your brain but also helps in energizing your entire body. During sleep, the body rebuilds itself. It gets time to rebuild itself. It's like formatting your PC. So your brain is rested. It formats itself. Not only the brain but also the muscles, bones, and all your digestive system. So these have the sleep is the time when your body is going to reprogram itself. What are the factors which will lead to disturbed sleep? It is high sugar levels. If one has high sugar levels, if there is a problem of prostate or uncontrolled diabetes, then frequent urination can lead to disturbed sleep. Obstructive sleep apnea, that is snoring. Patients who have this illnesses, can they generally have a bad sleep, and this leads to daytime sleeping. So please consult your doctor, and he will guide you what is the problem with you if you are not having good sleep. At least 6 to 7 hours of sleep is essential. I will also offer you some tips how to get a good night's sleep. So make sure your bedroom is quiet, calm, and cool. Reduce smartphone usage before bedtime. Avoid exercise, alcohol, and large meal just before going to sleep. Avoid caffeine content in your food after 4 p.m. and go to the bed at the same time every night. So these are certain tips, which you can use to have a good sleep. Now coming to diet, I'll be discussing diet a little in detail. So the essential constituents of diet are carbohydrates, fats, and proteins. Along with this, there are micronutrients and fiber. So these are the major constituents of a diet. And what you should have the idea of diet management or the diet changes one should do is that one should have a balanced diet. So there should be a good proportion of carbohydrates. I'll be discussing in detail about each factor. So a combination of all the constituents of a balanced diet, which should include carbohydrates, fats, proteins, micronutrients, and fiber. So all these constituents are important. Now, carbohydrates. Carbohydrates or the glucose. Glucose is the most important constituents. We eat because to live, so we are alive because of the glucose. That is that the glucose is the energy source of our body. So the dietary, whatever we are eating, majority of these are the carbohydrates. So these should constitute around 55 to 60% of your diet. We obtain carbohydrates from fruits, vegetables, whole grains, legumes, low-fat milk, dairy products. So we obtain carbohydrates from these sources. What the recent changes in the carbohydrates have we have seen are we are now eating a lot of refined sugars. Okay, maybe it is sucrose, that is the table sugar, or there is increased amount of rice and refined wheat flour, that is the maida. So this has led to a rapid rise in the blood sugar levels. If you eat a lot of processed carbohydrates, once you have a meal, your blood sugar levels will surge. This surge will cause an increased insulin production in your body. Insulin also acts as a growth factor. So this leads to obesity. And if you are overworking something, the pancreas has to increase has a increased workload to produce insulin. So it is working hard, and slowly its health deteriorates, and your beta cells reduce, and ultimately leads to diabetes. So what you should have is that your diet should contain a lot of complex carbohydrates. You have a 6-meter long intestines, and it can digest carbohydrates slowly. So what you are feeding to the intestine is that if you take refined carbohydrates, the proximal part of the intestine itself is able to digest the food. So the food doesn't enter the lower intestine. What you should have is complex carbohydrates, which is broken down very slowly, and the food, even small amount of food, reaches your terminal intestines. So this helps in reducing the surge of glucose levels after you have a carbohydrate diet. So instead of wheat flour, rice, and refined wheat flour, that is maida, what one should include in your diet is the millets. Traditional Indian millets like bajra, jowar, um, ragi, rajgira, or kuttu, kodu. So foxnut, foxtail millet. So these are traditional millets which one should include more in their diet. So instead of going for breads, you should have traditional, if you are familiar with Marathi food, then you should have bhakris of bajra or jowar. So these will help in reducing the glucose surge post meal. There is a common question, are artificial sweeteners beneficial? So I would say you can have an occasional sweetness. Various sweeteners are available in the market like sorbitol, aspartame, sucralose, stevia. So majority of these sweeteners, we have not studied it uh, for a longer time. These are these are products which have been detected maybe a decade back, and we have been using it since last maybe 10 years, and their usage is increasing. But what we see that short term, if you have a lot of artificial sweeteners, they tend to cause loose motions. Also, we are worried that long term they could prove to be carcinogenic. So use it with caution. Once in a while is fine. The biggest drawback which we see with artificial sweeteners is that they don't satisfy your brain. If you have a cup of tea with artificial sweetener, your brain is not satisfied. If the brain is not satisfied, the craving for food increases. You will end up eating some farsan, biscuits, or some other food. So if you calculate the entire day's calories, people who are using artificial sweeteners tend to eat more. So you are actually adding a lot of calories to your day, the daily. If you calculate in a day, so the total number of calories is actually increases if you are using artificial sweeteners. So use it with caution. Once in a while, if you have to, have a sweet tea, take it with artificial sweetness. But in general, avoid its overuse. Now coming to proteins. Proteins are the building blocks of our body. All our muscles, bones, organ cells, these are all made up of proteins. So there is a regular maintenance work which is happening in your body, and these proteins are essential. Traditional Indian diet is very much deficient in protein. The amount of protein one should take is 1 gram per kg. So if you are a, say 70 kgs man, should take around 70 grams of protein. The non-vegetarian sources of protein are meat, fish, and eggs. Vegetable sources are pulses, dairy products, soya, nuts, and broccoli. So these are certain examples of from where you can obtain high protein. See to it that all your meal contains at least 25 to 30% of your meal should be proteins. Nuts, unfortunately, the fat to protein ratio is very high. So you get protein from whole nuts, but along with that, you get a very high fat content also. So you should have dry fruits in moderation. Now fats. So you have to reduce the fat intake to less than 25%. There are a lot of misconception about fat, that one should avoid fat at all. One should not, the fat is an important factor. It is a fuel for heart. So heart uses fats for it as a fuel. Fat is also essential for brain work. So a lot of memory issues, if you have a complete fat-free meal, you'll have a lot of memory issues. Your neurons or the brain cells will deteriorate faster. So a small amount, that is less than 25% of your diet, should contain fat. Again, lot of conceptions are, lot of oils have cholesterol. So none of the cooking oil which we use have cholesterol. Our body makes cholesterol. So our body can make its own cholesterol, and the raw material for this cholesterol is sugar and fats. So even if you don't have fats but you have a lot of sugar, this sugar cannot be stored in the body as sugars, but it has to be converted into fats. So if you are if you are taking a lot of sugars and oil, ultimately this leads to increase in your cholesterol levels. All oils have same calories, that is 1 gram. So you have sunflower oil, safflower oil, olive oil, groundnut oil. Every oil, the calorie content is the same. That is 1 gram is equal to gives you 9 kilocalories. Not all oils are suitable for cooking. Especially, I would like to mention that olive oil, it is not suitable for cooking. So whatever benefits which one gets from olive oil are lost if you heat it. Using the same oil repeatedly can have toxic effect on your body. which oil is the best? I would suggest that reduce the oil content, whatever, to less than 25%. Avoid oil as much as possible. Traditionally, for Indian cooking, mustard oil, canola oil, and ghee, these are the preferred oils. Olive oil, unfortunately, is not good for cooking because the essential nutrients like MUFA and PUFA, monosaturated fatty acids, and linoleic acid, that is the MUFA and PUFA, are the benefits of which one gets more from olive oil. So these are lost if you uh, you know heat the oil. Mustard oil, groundnut oil, and sesame oil are best suited for Indian cooking. Reduce as much as possible. If at all you have to use it, these are the preferred oils. Salt. Restrict the salt intake to less than 3 grams, 3 grams per day. Yeah, salt, if you reduce it, not only helps in controlling blood pressure also diabetes. So in diabetes and hypertension patient, we recommend that the total daily intake should be less than 2.5 grams per day. One of the most neglected factor is the fiber. Your diet should contain at least 50 grams of fiber. Now, we have a tendency to have fruit juices. I'll give you an example that if you take a glass of fruit juice, you take sugars from 3 sweet limes. If you have a glass of sweet lime juice, you will require 3 sweet limes for making a glass of juice. So you'll have sugars from three sweet limes. Instead of this, if you have 1 whole sweet lime, you will have only sugars of 1, but will get enough fiber which will help you in digestion. So fibers not only help in having good motions or helps you in digestion, but also helps in reducing your blood sugar levels. So because of this fiber, the carbohydrates takes longer time to get digested, and there is a lesser surge in glucose level post meal. So see that you get lot of fiber. You can get fiber from whole fruits, vegetables, and also we have lot of fiber, like isabgol fiber, which one can have after dinner or after meals. This helps in digestion as well as reducing your sugar levels. Now coming to alcohol, I would say that even a small amount of alcohol is toxic to your body. It not only affects your liver, but also affects all other vital organs like kidneys, heart, and brain. So I would say that you abstain from alcohol as much as possible. A little, once in a while, social drinking I would permit, and that social drinking should be limited to 1 drink for women and less than 2 for men. What alcohol does, it not only it's toxic to your liver, but also in short term, it will reduce the cognitive function or the brain activity, and you are not able to take quick decisions. This leads to accidents or social embarrassments. Alcohol can also cause low sugar, that is hypoglycemia, in patients who are using insulin or diabetic tablets. Preferably, drinks should be taken after food. Those should be avoided on empty stomach. So these were certain lifestyle factors that one should be aware of. So to just summarize that, we are seeing the lifestyle illnesses are on the rise. One should focus on eating a healthy diet, regular exercise of at least 30 to 45 minutes per day, stop smoking and alcohol consumption, do regular health checks, and discuss your health issues with your doctor. So friends, this...
Thank you very much, Doctor. Very detailed presentation, and I'm sure a lot of questions that people have asked have been addressed already in your presentation. But with your permission, I'm going to start, taking some of these questions that have come in. You have spoken about sleep, etc. There's Shilpi Bishwas, who's 67. Question is, how necessary is it to take shingles vaccine? There's a question from Archana Gupta, who has also spoken about flu vaccine. Is it necessary and is it effective?
Shingles vaccine is definitely recommended, especially patients who have a history of herpes in the past, and the herpes zoster is a very painful illness. Okay, not only causes skin lesions, but the pain can last up to months after an infection. So we are recommending it, especially for immunocompromised patients. Old age patients can get benefit out of this. Patients with asthma, patients with COPD, or major illnesses like heart patients and stroke patients. So we are presently recommending for them. And patients who are above 60 years are definitely can take.
We have a question. Yeah, we have a question from Sunita Verma, who asks, is vegan diet good or is it deficient in some nutrients?
The only deficient would be vitamin B12. Unfortunately, there is no vegetable source for vitamin B12. But nowadays, we are getting a lot of, easy and very economical supplements of B12 are available. So if one, wants to go for vegetarian diet, he is always welcome. And provided he has regular checks for at least yearly checks for vitamin B12 and see that he is not deficient. If he is deficient, he needs to take supplement.
Vegan would mean, of course, even dairy products not being there.
See, that is a personal choice, I would say. If you want, my opening statement about diet was a balanced diet. We should include everything. But if one opts for vegan diet, that is fine. But vitamin B12 is a matter of concern.
It's an interesting question that Sunita Verma has asked. Why is lactose intolerance and gluten intolerance more prevalent nowadays?
Gluten intolerance is because we are now reduced the fiber from the wheat. Okay, so wheat and the refined flour, maida, this has a lot of glutens. So if you remove fiber, this is going to give a lot of trouble. See, if the maida roti gets cold, it is very difficult to break it by your hands. You just imagine how your intestines are suffering. So what occurs is that the food is not able to move forward. The intestines are not able to digest it. It remains static. And a classical food is that chole bhature. You have a gluten, you get gluten from bhature, and the chole produce a lot of gas. So these patients will develop a severe bloating. Okay.
But doctor, tell me something now. All of us, to an extent, while we all hear these things, how easy or difficult is it? Say for somebody like yourself, how easy or difficult is it to stick to this kind of a abstinence virtually?
See, unless you make an effort, you are not going to change. So whatever is there, I'm presenting you what are the healthy options.
Right.
So in today's lifestyle, sometimes it becomes difficult, to totally abstain from refined flours. Okay, but then if you have to, you have to make certain decisions. You have to take certain steps to avoid this. If you are having gluten intolerance, there is no point in taking gluten. So what one other way is that you have a lot of fiber along with gluten. If at all you have to eat someday, you have. See, if I go to a party, I cannot expect them to give jowar roti and bajra roti. So then I had to eat a wheat or maida roti. So what I do, I eat a lot of fiber along with this. This will help in moving the food or getting the food digested properly, and I'll have less bloat.
Fibers along with special with maida, etc. So salads and whatever else, or if that is not available, then come home and have some isabgol. Yes. Right. There are two questions around this. One is from Rashmi Barma, and the other is from Vijay Ganduri. Any special diets for hypothyroid or restrictions, if any? Vijay asks is, For hypothyroid patient, dietitian suggests to avoid cauliflower, cabbage, soya. But the doctor says there's no need to restrict this as patient is taking thyroid medication. It's confusing. Your take.
Okay, I'll just simplify this query. Uh, Hypothyroid is majorly because of two reasons. One is because of iodine deficiency. Iodine deficiency traditionally is not seen in maybe in the coastal areas, but it is seen in the foothills of Himalayas, especially villages of Uttar Pradesh and Bihar, where the water is essentially deficient in iodine. In these patients, one should avoid cabbage, cauliflower, and soya. Why? Because they tend to chelate the iodine molecules, and they will prevent its availability. So patients who are deficient in iodine need food restrictions. But what we see rest of the India is that the hypothyroid reason behind it is autoimmune destruction of thyroid gland. So your thyroid gland has got destructed by your own cells. So there is not enough thyroid tissue to make enough hormone. So you are deficient in hormone. In this case, the only method of treating this is to take external supplements. Unfortunately, no diet is going to help in this. So if you are deficient in iodine, then our doctors will put restriction on food items. Otherwise, there are no food restrictions.
Right. Doctor, we have a question from Shobha Srivastav. Again, too many questions on diet. Should we consume turmeric milk, haldi doodh, as they have? Is that something that you advise? And also, since you're talking about haldi doodh, there are various natural potions that are there. I'm not talking about Ayurvedic medicines, but the general medicine, the potions that people advise over a period of time, whether it is ajwain water, whether it is adrak chai, etc. Are these things helpful, or are these just they help in easing the pain or the throat itch, etc.? What is the medical view?
See, turmeric, ginger, cloves, these are traditional medicines which we have been using since long years. So definitely they have benefits. Turmeric milk, especially if you take it at night, it helps in improving your immunity, helps in digestion. It reduces your stress level. Unfortunately, we have not studied these enough in a scientific way, or the way the world sees it. Okay, if you don't have a scientific data, then it is very difficult to justify these things. So it is our unfortunate state that we are not studying our own products. I think more studies on these with a scientific approach has to be done, so that we can say with assurity that taking a glass of haldi doodh is going to be this beneficial, or this is going to help in these. Now just speaking up vaguely about this doesn't make me very convincing. So it is our lack of not experimenting or not doing proper scientific studies on them that is causing this confusion.
So to what extent is it, let me put it this way, to what extent can you have it so that it's not harming one's body?
Have it in moderation. You can have a glass of haldi milk, 1 glass in a day at night, if you prefer, or you can have a ginger tea once in a while. If you have a cup of ginger tea, if you have a sore throat or that, it is fine. That is okay. But you should not have too much of this product. Unfortunately, the government regulation or on the standardization of these products is also not so good. So what haldi you are buying, whether it is adulterant free, and what is the source. So these also things matter.
Right. Doctor, we have a question from Mr. P.N. Kutti, and I guess the fact that he's coming from that part of the country. What is your view about coconut oil?
Coconut oil is high in saturated fat. Western media is very negative about coconut oil, but we as Indians, we see that we get a lot of benefits from coconut oil. Coconut oil is good if you are living around the sea coast of India. Okay, for that climate, coconut oil is very beneficial. But if you are living a little interior of India, then I would suggest that that benefit you will tend to lose if you are indulging too much into coconut oil. So have a little oil in moderation. Coconut oil is good for your hair, body, skin, and even for health. But preferred, people who should consume are the people who are living along the sea coast.
And doctor, what about cold pressed oil versus the ready-made oils that are available in the market? Would you advise cold pressed oils?
Pressed oils are definitely best because maybe what you see, you can get them fresh also. Unfortunately, the refined oil which you obtain, this is how the process for obtaining refined oil is that you mix the crushed nuts with hexane, which is a petroleum product. Then this hexane is evaporated, and what the oil you get is um, refined flour. If you do by traditional kachi ghani is what we call cold press. So if you do, there is 10 to 15% wastage of oil. Whereas in refined oil method, the wastage is only less than 5%. So definitely economics is having an upper hand, and one is going for refined. The rates, the prices are also lesser for refined. But if you want a good oil, I would suggest that have cold pressed.
Great. Thank you very much, Dr. Sandeep Sonawane, for this amazing session. You've answered several questions. I know there are several questions which people still have, but this is what. Okay, there's a question that has come in and I did not ask earlier. What about IBS if one has?
Again, irritable bowel syndrome.
Right.
Again, this is not only an illness which is restricted to digestive system, but now we are getting a whole idea that this could involve the entire body. It is the gut, which dictates to the rest of the body or the rest of the organs. So what happens in IBS is that every time you eat your food, the intestines being hypersensitive tends to have increased motility. So every time you have a piece of meat, the intestine movements increases, and you have to go to the washroom. So this is essentially a sensitivity of intestines. But the reasons behind this is not only the food what you are eating, but also the stress, the brain status, the medicines which you are having, the heart status, the lungs status, the liver status, the kidney status. So these all things are contributing for that. Try to relax yourself, live a stress-free life as much as possible. Diet, I would say that you should have a lot of fiber in your diet, eat more probiotics, uh, less of refined flours and less of sugars. So this will help in controlling IBS.
Right. Thank you very much. Of course, we've had a special session on IBS and Crohn's disease, if you remember, just a few weeks back, taken by Dr. Prasanna Shah. So you can refer to that on the Seniors Today website, that is seniorstoday.in/webinar, and you will be able to locate that session by Dr. Prasanna Shah. Thank you very much, Dr. Sandeep Sonawane, for this amazing session that we've had. I think lifestyle issues are important. Lifestyle changes are important, and clearly that's the take-home message that is there. Of course, it's not just a message, but Dr. Sonawane has given us real examples of how you can look at doing things, including the fact that if you do go for a party and if you do have those chole bhature or some maida stuff, what you can do to ensure that you balance it out and you ensure that there are enough fibers that you intake, that you consume. Thank you very much to Dr. Sonawane, and thank you to the team at the Kokilaben Hospital for facilitating this. And to all of you here, please keep reading Seniors Today and track all our events on the Evergreen Club, which has multiple events every day, and it's free of cost. There is the health webinar where you can pre-register, and Seniors Have Talent has started once again. We are going to be having the C round. Dr. Sonawane, I must tell you that this is the 17th season of Seniors Have Talent, which is happening, and there are people only above the age of 60 who are performing, and it's an amazing session, even if I say it myself. And there's an entire community of people who are now, who are there. They are going on travel holidays. They've just gone to Goa and Kerala, and now they're all getting set to go to Kashmir. So it's an entire, ecosystem we have built around senior citizens over here. Thank you very much, Dr. Sonawane, for taking your time and for speaking to senior citizens out here. And we will be back once again next Saturday at 5 p.m. for another session of Health Live at Seniors Today. Thank you very much.
It was a pleasure to address you all, and I wish you all good health.
Thank you.
Thank you.
Subscribe now and press the bell icon. Never miss an update.